Around 2% of pregnancies will result in the birth of a baby with severe mental or physical abnormalities that are regarded as incompatible with life or severely life-limiting. For example, these babies are born without most of their brain having developed, with open spines or open skulls, organs that have not developed, or conditions that will require constant medical intervention and result in short, uncomfortable lives. In South Africa, we often identify such severe conditions only later into pregnancies due to the lack of access to the necessary antenatal health care and screening in our public healthcare system. Consequently, the option to end the pregnancy beyond the point of fetal viability is frequently made available. This means that even though the pregnancy is ended, it might not result in a stillborn baby. In order to ensure an ended pregnancy, it is thus best practice to stop the fetal heartbeat prior to inducing labor. This medical procedure is referred to as feticide and usually entails the injection of potassium chloride into the fetal heart. My research explores how women experience the diagnosis, decision-making, the procedure, and adjustment to life following a feticide. I'm also interested in how the doctors who perform the procedure and medical staff who treat these women perceive their experiences and how this affects them as well. The value of my research lies in providing a platform for women to voice their experiences without being stigmatized. Silencing is pervasive among women who have experienced feticide, mainly due to a lack of awareness of this procedure within South African society and prejudicial attitudes towards women's rights to bodily autonomy. Healthcare providers would benefit from greater exposure to a holistic and systemic understanding of the dynamics South African women face in accessing adequate antenatal health care, the impact of poverty, unemployment, and structural inequality on their ability to sustain the pregnancy and life with a special needs child. I conclude with a quote from one of my participants. For me, it would have been, if I don't want to talk about it, it is because I am still too sad, because I don't want to open up all the old wounds and have all these memories back. And of course, a person doesn't want to because you already feel judged. You don't want to feel judged because the first thing is you get judged.